So let's face it, if your child is sick or has a fever, it can be pretty frightening, especially for new parents. So when you have to deal with a fever, let's give you some tips so you can think straight and best help your child. First of all, a fever is the body's immune system working. It's helping your child get better from an illness. What is the definition of a fever? Usually we'll say it's 100.4 degrees. And how do you best measure the temperature? You could use the back of your hand, and that might work well for an older child. But for a younger child, and especially for a child under 3 months of age, we need a more accurate number. So if you have a child who's 3 months or younger, a rectal temperature is the best way to go. Not the most pleasant thing to do, but it gives us the accurate number. For an older child, a thermometer that goes into the ear would be accurate, and also the temperature scan that can be done on the skin. Before we go farther, again, under 3 months of age, if your child has a fever of 100.4, that is more of an urgent, emergent situation. Please contact your physician. Please seek immediate care. So, let's say your child does have a fever. What do you do? First thing is you want to look at the big picture and make sure your child is comfortable. Is there a number that worries us? Great question. Maybe if we're starting to get into the 105, 106 range, that would be of concern. But most of the time, I'm going to tell families, how's your child doing? I worry more about the child who has no fever, but isn't playing, isn't reacting, than the child with 102 fever who seems pretty happy and still interacting. So look at the big picture. If your child's still playing, still eating, still interactive, still wetting diapers, lower level of concern. So again, fevers are not necessarily bad or dangerous by themselves. What do we usually want to do with a fever is make the child more comfortable, and that's where you often will use medication. The most common would be acetaminophen or ibuprofen. How do you decide the dose? This, of course, is contingent on what does your child weigh. So we use their most recent weight, and if you look often online, there will be tables to help you. I will often get asked, should we switch between ibuprofen or acetaminophen? To be honest, if you find one that works, please stick with it. It's just less confusing for you as a parent, and there's less chance of medicines counteracting each other. Let's also realize a lot of other over-the-counter cold and flu medicines may have ibuprofen or acetaminophen in them, and then you run the risk of overdosing. So usually we'll say, especially in kids under 2 or 3, ibuprofen or acetaminophen only, and no other cough or cold medicines. Now, please also realize that ibuprofen should only be used in kids 6 months and above. So once you figure appropriate dose, acetaminophen's every 4 to 6 hours, ibuprofen more every 6 to 8 hours. Your goal is to make your child more comfortable. If they start off with a temperature of 102 and the ibuprofen brings it down to 100.5, technically still a fever, but they're happier, you should feel happier. When you get real concerned is if other things are going on. Your child has a higher temperature, they're not playing, they're not feeding, they're not wetting diapers every few hours, they get a funky rash. You as a parent just aren't comfortable with how they're acting, make a phone call. Call your trusted pediatrician, give us a shout. We can walk you through things. We can decide if we need to see the child and help out. Now again, under 3 months, any temperature over 100.4, I'll make it even over 100, probably needs immediate medical care. So again, yes, fevers can be scary, fevers can cause you to be worried, but if you walk through the big picture and you think about the first goal is to make your child comfortable, then you will be doing them a service. And if at any time you are uncomfortable with temperature, uncomfortable with how your child is acting, please give the office a call. Let us help you through these situations.